Arthritis is one of the most painful and devastating conditions that seniors in the United States, United Kingdom, Canada, and Australia are facing right now, stripping away independence, crushing mobility, and stealing away simple joys like gardening, walking the dog, or even opening a jar. Every day, millions wake up to stiff, aching joints that make just getting out of bed a brutal task. We are talking about real suffering, real life-changing pain that too often gets brushed aside as just getting older. The first point that must be tackled is reducing the inflammation that fuels arthritis pain, because inflammation is like pouring gasoline onto an already roaring fire inside the joints. In the United States alone, over 58 million people have been diagnosed with arthritis, and many healthcare experts are speaking out that chronic inflammation is the true root cause of the damage, not just simple wear and tear. One of the most effective ways to fight inflammation naturally is through dietary changes. Researchers from top U.S. universities like Harvard and Johns Hopkins have highlighted that seniors who switch to an anti-inflammatory diet rich in omega-3 fatty acids, from wild-caught salmon, flax seeds, walnuts, and chia seeds, can experience significant reductions in joint pain. It is critical to focus on whole foods, avoiding processed junk that is packed with inflammatory oils like soybean and corn oil, both heavily used in the United States food industry. Turmeric, ginger, and green tea are powerful anti-inflammatory agents that have been used for centuries in other cultures and are now being embraced more in places like Canada and Australia. Seniors have shared emotional stories about how just swapping their daily processed snacks for anti-inflammatory smoothies packed with leafy greens, berries, and turmeric reduced their morning stiffness dramatically within weeks. One emotional reality that needs to be discussed openly is the way arthritis isolates seniors from their loved ones, especially in the United States, where families often live spread across states. When you cannot move easily, when every step feels like knives stabbing into your knees or hips, socializing starts to vanish from your life. This fuels depression, anxiety, and worsens physical health. That is why joint support supplements can be a lifeline, giving many the ability to reconnect with the world around them. Clinical trials conducted in the United Kingdom and Australia have found glucosamine sulfate and chondroitin sulfate to be highly beneficial for many seniors. These compounds work by nourishing cartilage, the protective padding between bones that arthritis steadily eats away. In one large study published in the British Medical Journal, seniors who took glucosamine sulfate daily had 20% less knee pain after just 3 months compared to those who took a placebo. Yet, it is crucial to choose high-quality, pharmaceutical-grade supplements because the United States market is flooded with cheap versions that offer little real benefit. Staying active even when the body is screaming in pain sounds cruel, but gentle, consistent movement is scientifically proven to be one of the most powerful tools against arthritis. Physical therapists in the United States emphasize that motion is lotion for the joints. Seniors who engage in low-impact exercises like swimming, water aerobics, tai chi, or stationary cycling build muscle strength around their joints, which acts like a supportive brace. Without this critical muscle support, the joints themselves bear the full brunt of body weight and pressure, speeding up destruction. In Canada, many senior centers have introduced specialized arthritis-friendly yoga classes, showing remarkable improvements in flexibility, strength, and mental health after just 12 weeks. Water exercises are particularly celebrated because they allow seniors to move freely without the burden of gravity grinding their joints down. In the United States, facilities like YMCA and senior community centers are offering arthritis-specific water therapy classes, and seniors who once felt trapped by their bodies have cried tears of relief after their first pain-free workouts. Another point that cannot be overlooked is the devastating effect of being overweight on arthritic joints. Carrying just 10 extra pounds puts about 40 additional pounds of pressure on the knees with every step, according to data from the Arthritis Foundation, a major nonprofit based in the United States. This mechanical overload tears away at the cartilage and inflames the joint linings. Weight loss is not just about vanity. It is a survival tool against the crushing pain of arthritis. Seniors who drop even 5% of their body weight report substantial improvements in pain and function. Nutritionists in Canada and the United Kingdom stress that seniors need nutrient-dense, low-calorie foods to lose weight safely, such as wild blueberries, spinach, avocado, and lean grass-fed meats, commonly available in high-quality U.S. grocery stores like Whole Foods and Trader Joe's. Emotional testimonies abound from seniors who lost 20 or 30 pounds and found themselves able to play with grandchildren, walk on the beach, or dance again after years of pain. Pain management with over-the-counter medications is a reality for many, but it must be approached with extreme caution because long-term use of NSAIDs like ibuprofen can destroy the stomach lining, cause bleeding ulcers, and even increase the risk of heart attacks, according to warnings issued by the U.S. Food and Drug Administration. Seniors often find themselves trapped between unbearable pain and dangerous medications. Healthcare providers in the United States, Canada, and Australia are pushing for safer options such as topical NSAIDs, which deliver medication directly to the joint with less systemic absorption. Voltaren gel, widely prescribed in the United States, has been a game-changer for many seniors who cannot tolerate oral painkillers. Real stories from elderly individuals reveal how applying a topical gel allowed them to reduce their pill burden drastically, easing both their pain and their constant fear of dangerous side effects. Assistive devices are another critical and often underappreciated weapon against arthritis pain. Many seniors feel ashamed to use canes, walkers, or braces, viewing them as symbols of defeat, especially in American culture where independence is prized so highly. But the truth is, the right device can be a bridge to greater freedom and less pain. Occupational therapists across the United States and Canada strongly recommend customized orthopedic braces, which can unload pressure from damaged joints and make walking possible again. Lightweight canes with ergonomic handles or rollator walkers with seats provide not just support, but dignity, allowing seniors to move through malls, parks, or even just their homes without fear of falling. In Australia, new smart technologies are being introduced, such as GPS-enabled canes and fall detection wristbands, offering seniors even more security and independence. Seniors have emotionally described the first time they used a properly fitted walker not as a moment of defeat, but as a day when they got their lives back. Temperature therapy is another simple but incredibly effective tool for arthritis relief. In the United States, many seniors swear by alternating hot and cold therapy. Heat pads can soothe stiff joints, relax muscles, and increase blood flow, especially first thing in the morning when arthritis pain is at its worst. Cold packs are critical after any activity that causes joint swelling or inflammation, providing numbing relief that can prevent a minor flare-up from turning into a full-blown crisis. Physical therapists recommend 20 minutes of heat, followed by 20 minutes of cold, to control inflammation without relying entirely on medication. Real seniors tell stories of how an inexpensive heating pad became their best friend during harsh winters in Michigan or Alberta, Canada, when cold weather triggered brutal arthritis flares. In warmer areas like Texas or Florida, seniors often keep gel ice packs in their freezers to grab after gardening or walks, preventing the kind of swelling that can take days to calm down. Stress management is a powerful but often overlooked aspect of controlling arthritis pain. Chronic stress, common among seniors dealing with medical bills, loneliness, or declining independence in places like the United States and United Kingdom, floods the body with cortisol, a hormone that worsens inflammation dramatically. Studies have shown that seniors who practice mindfulness, meditation, or guided breathing exercises experience real reductions in arthritis symptoms. Mental health care must be part of the treatment plan, not a luxury. Emotional support groups. For arthritis sufferers, such as those organized by the Arthritis Foundation in the United States or Arthritis Society in Canada, provide critical outlets for grief, anger, and fear. Seniors have shared gut-wrenching stories of sitting alone day after day until joining a support group changed everything, reminding them they were not alone in their pain, their frustration, or their hope for a better life. Natural therapies that have been heavily studied in the United States are gaining serious traction among seniors desperate for real, lasting relief without dangerous side effects. One of the most promising is acupuncture, an ancient technique that involves inserting very fine needles into specific points of the body to rebalance energy flow and stimulate healing. In trials funded by the National Institutes of Health, seniors with moderate to severe arthritis reported significant improvements in pain and mobility after just 8 weeks of regular acupuncture treatments. Clinics across the United States, Canada, and Australia are now offering arthritis-specific acupuncture sessions, often with insurance coverage, making it an accessible option for many. Seniors who were once skeptical now tell deeply moving stories of how acupuncture sessions gave them back restful sleep, allowed them to enjoy meals again without pain in their hands, and even helped them regain the ability to garden, a passion they thought they had lost forever. Massage therapy is another tool that too many seniors overlook. Yet studies from leading U.S. institutions like the Mayo Clinic and Cleveland Clinic show that regular massages can decrease stiffness, improve range of motion, and even lower inflammatory markers in the blood. Special arthritis-focused massage techniques using light pressure and focusing on the fascia and connective tissues can produce remarkable results. Seniors in the United States, United Kingdom, and Canada who have incorporated weekly massages into their health routines speak emotionally about feeling their body come alive again after months or even years of frozen, painful joints. The emotional healing from human touch, the easing of anxiety, and the boost in circulation all contribute powerfully to improved quality of life. It is not just about pampering, it is about strategic healing that touches both the body and the spirit. Medical cannabis has also entered the conversation in the United States and Canada, where legalization has opened doors for seniors suffering from arthritis. Cannabidiol, CBD products, which are non-psychoactive, offer pain relief and reduced inflammation without the high associated with marijuana. Seniors often start with CBD creams applied directly to the joints or tinctures taken orally. Research, published by the Arthritis Foundation, found that over 80% of arthritis patients using CBD reported improvement in physical function, sleep, and pain levels. In emotional testimonies from seniors, many say that CBD gave them their first real relief after decades of living at the mercy of prescription drugs that never quite worked. In states like California and Colorado, arthritis-specific cannabis clinics provide tailored regimens for older adults, offering education and carefully dosed products that prioritize safety and efficacy. Sleep is another critical but underestimated factor that drastically affects arthritis pain. Poor sleep triggers more pain, and more pain destroys sleep quality, creating a vicious cycle that devastates seniors' health. Studies from the United States show that seniors with arthritis often experience fragmented sleep, with constant waking due to joint pain. Yet sleep is when the body does its most important healing work, repairing tissues and reducing inflammation. Sleep specialists recommend specific strategies like using body pillows to support sore joints, investing in high-quality mattresses that offer both support and cushioning, and maintaining a consistent bedtime routine free of screens and stimulants. Emotional reports from seniors highlight the dramatic difference that good sleep can make. One woman described feeling like she had lost 20 years of pain after finally learning how to sleep properly through arthritis pain. Seniors across Canada and Australia are also increasingly turning to natural sleep aids like melatonin and magnesium glycinate supplements to improve sleep quality safely. Vitamin D deficiency is another massive silent contributor to arthritis suffering, especially among seniors in the United States and the United Kingdom, where indoor lifestyles and northern climates lead to chronic low levels. Vitamin D plays a critical role in bone health and immune regulation. Without enough of it, inflammation runs rampant, bones weaken, and pain intensifies. A large study conducted in the United States found that seniors with the lowest vitamin D levels had the highest reports of joint pain and disability. Blood tests ordered by healthcare providers can quickly identify deficiencies, and supplementation with high-quality, bioavailable vitamin D3, often combined with vitamin K2 to protect heart health, can make a profound difference. Seniors emotionally describe how simply correcting a vitamin D deficiency lifted a heavy veil of pain and fatigue that had clouded their lives for years, allowing them to feel the sunshine not just on their skin, but in their bones. Hydration, often overlooked, is crucial for joint health because joints are lubricated by synovial fluid, which depends heavily on water. Dehydration thickens this fluid, making movement stiffer and more painful. In the United States, where coffee and soda consumption is extremely high, many seniors are chronically dehydrated without realizing it. Health experts recommend drinking half your body weight in ounces of water every day, a standard pushed heavily by wellness movements in the United States and Canada. Seniors who committed to proper hydration tell powerful stories of reduced morning stiffness, easier movement, and even improved skin and energy levels. Adding electrolyte supplements without added sugars can also help maintain hydration more effectively, especially in hotter climates like those found in southern parts of the United States and Australia. It is critical to address footwear because the wrong shoes can destroy already fragile joints, causing pain to skyrocket. Orthopedic surgeons and podiatrists across the United States are warning seniors that thin, unsupportive shoes wreak havoc on knees, hips, and lower back. Investing in orthopedic shoes with proper arch support, cushioning, and stability can reduce joint shock dramatically. Seniors in Canada and the United Kingdom report life-changing improvements after switching to brands designed specifically for arthritis sufferers. Emotional testimonials pour in from seniors who were able to return to daily walks, shopping trips, and even low-impact hiking after finally being fitted with the right shoes. Medicare in the United States often covers part of the cost for custom orthopedic footwear for qualified seniors, making this important investment more accessible. Joint injections, particularly with hyaluronic acid, are a more aggressive but sometimes necessary intervention for moderate to severe arthritis. In the United States, these injections are offered widely in orthopedic and sports medicine clinics. Hyaluronic acid acts like a lubricant and shock absorber inside the joint, restoring some of the cushioning that arthritis has destroyed. Although not a cure, these injections can provide months of reduced pain and improved function. Seniors often describe the emotional experience of walking upstairs again or going for a drive after receiving injections that took their pain from a crippling 9 out of 10 down to a manageable 3. In Canada and Australia, similar treatments are offered, though access can vary based on public health care systems. Seniors must advocate fiercely for themselves to get referrals to arthritis specialists who offer these injections rather than being dismissed with yet another prescription for pills. Surgical interventions like joint replacement must be considered when conservative measures fail, and the emotional reality is that many seniors delay surgery far too long because of fear, cost, or misinformation. In the United States, total knee and hip replacements are among the most common and successful surgeries performed on seniors, with success rates above 90%, according to the American Academy of Orthopedic Surgeons. Yet the decision must be made before severe muscle atrophy and bone deformity occur, or outcomes are poorer. Seniors who underwent surgery often describe it not as an end, but a beginning, a rebirth into a life with movement, connection, and joy restored. In Canada, wait times for joint replacement can be long, creating additional emotional strain and forcing seniors to find temporary pain solutions while awaiting surgery. In Australia and the United Kingdom, similar issues arise, but innovations in surgical techniques like robotic-assisted joint replacement are offering hope for faster recovery and better outcomes. Family support and caregiver education are absolutely essential for arthritis management, but are too often neglected, especially in the fast-paced healthcare systems of the United States. Seniors need advocates, helpers who understand not just the physical demands of arthritis, but the emotional toll as well. Family members must be educated on how to assist without patronizing, to empower rather than enable. Real stories from seniors show how relationships either blossom or wither depending on how well families adapt to the new realities of living with chronic pain. Caregiver burnout is real and must be addressed openly, with counseling and support groups available across the United States, Canada, and Australia.